Hi, I'm Dr. John Martin with Ivy Family Health Updates, and I'm here today with my brother Dr. Edward Martin, my sister Dr. Catherine Martin, and our special guest Dr. Dan Nichols. Dan is a graduate of the University of North Carolina at Chapel Hill, where he got both an undergraduate and a dental degree. And he's here today to talk to us about teeth bleaching, which is a very, very popular topic these days. Dan, thank you for being here with us, and tell us a little bit about how can we bleach our teeth.
Okay, well, first of all, bleaching has been around for about 15 years. It's become very, very popular. Like you said, people are just, I think this baby boomer population has gotten to be more and more concerned about their looks, and bleaching has just become very, very popular with, with all segments of the population. So these are some of the colors that we used to work with.
Let's take a close-up look at these so you can really see what we're talking about here with the colors.
These used to be the colors that we had available to match people's teeth when we were doing crowns and bridges if people had an injured tooth or a broken tooth. In today's day and time, we've actually had to have the labs come up with something that's much whiter. With people bleaching their teeth now, the conventional shades that we used to use no longer work because they're just not light enough. People have bleached to much lighter shades now, so we had to come up with something that we could actually use to match shades that people had bleached their teeth to.
That's a huge difference.
So there's an incredible difference between what we had available 15 years ago and what we have today.
Okay.
Okay, so now let's talk about some of the products we have available. There are two types of staining. There are extrinsic staining, which is surface stains that are caused by red wine, tobacco, coffee, tea, sodas, anything that stains the outer surface of the tooth. And then there's intrinsic staining, which is something that happens to the tooth as the tooth is forming, as the tooth is growing and forming in the mouth. So these would work well
like
for
the tetracycline staining.
Tetracycline staining,
okay,
which was a big one years ago before we knew that the tetracycline was incorporated into the tooth formation as the teeth were forming. But these products are available at most any grocery store or drugstore. Remove extrinsic stains, so coffee, tea, red wine, things like that. They're just abrasive.
And it's a toothpaste.
These are just toothpaste, but they have abrasive agents in them, so they tend to just remove extrinsic stains, like we talked about, just through abrasion only.
Okay.
They don't really bleach the teeth.
Would this be a good thing for a regular coffee drinker to use on a regular basis?
It's good, but it's also, because it is abrasive, it can make your teeth more sensitive.
Okay.
So if you have any recession, things like that of the gums, it might be something you would want to avoid.
Could it actually damage your teeth long term if you used abrasive? I mean, would you be wearing down your enamel by using something?
Slowly over a period of time, you would be wearing away the enamel. So I tend to try to avoid and tell my patients to avoid abrasive things, abrasive paste and things like that. Now, as far as affecting or bleaching the actual teeth and affecting the intrinsic color, we have products like this one where you have a bleaching tray, which is really in this kit is actually one size fits all. The active ingredient is hydrogen peroxide, so you place the bleaching gel in this and you place it in the mouth and you wear it for this says 5 minutes. But it is a hydrogen peroxide based product. The fact that you're only wearing it 5 minutes, you're probably not going to see a lot of color change in just 5 minutes. It's just not present against the tooth long enough to really change the color of the tooth. You have other things like the Crest White strips, which have worked really well, but again, it's a low strength hydrogen peroxide. The thing about the white strips is that it's a cellophane with the bleaching gel embedded on it, so you just place it around the teeth and the moisture activates it. So this is a little neater in the fact that you don't have the gel and you have to apply it, you just stick it to your teeth. But it does affect the intrinsic stain, so it actually does bleach the teeth from inside.
Okay.
Rembrandt.
I know people that I know with Crest White strips say it works, it just takes a while.
Right.
Yeah.
It does. It takes longer. A lot of these work very well if you're willing to, put in the time and the effort, but we often aren't as compliant as we should be when it comes to things like this. So then we have the Rembrandt, which is very similar. Again, you have the stock tray or one size fits all with the bleaching gel, and you just apply the gel in the tray and place it in. And this one, I think it says wear 30 minutes twice a day. So, the over-the-counter products, just read the instructions and, and follow them. Again, with the over-the-counter products, you really aren't going to see as much bleaching as you probably are going to want to see.
Mm-hmm.
You probably won't be happy with it. Most people who start with these end up at the dentist doing something more because they just don't get the results that they want to achieve. The first system that the dentist came out with was really taking and making a custom tray such as this. So they would make an impression, pour a mold, and then this would actually be made to fit your individual teeth. And the fact that it fits your individual teeth, you just apply the gel into the tray and then you place it over the teeth. The good thing about this is it just fits around your teeth. So you don't have to use as much gel. You don't get as much gel leaching out of the tray. So the gel stays against the teeth longer. So you get a much better bleaching result because the hydrogen peroxide is against the teeth much longer. And it's more comfortable to wear. So you're not losing the gel from out of the tray because it fits very tightly against your teeth.
Okay.
So this works very well. The strengths can vary: 15, 20, 25% hydrogen peroxide or carbamide peroxide. They both work equally well as far as bleaching.
The higher strengths just work more quickly?
They work more quickly. They can make your teeth more sensitive, but generally that's transient. That does go away. The last system that I'd like to talk about is really the in-office, which is a very high concentration of hydrogen peroxide, generally 35%. The tissue is isolated so you don't get any burning of the tissue, and then the gel is applied and then a light laser activated, and you sit under that for about 30 minutes to an hour, and then you get your bleaching. That does most of the bleaching, and then most dentists will give you something like this to take home with you, and you can do your touch-ups after that. You'll get your initial bleaching at the office, and it's, for non-compliant people, it works very well because you get your instant bleaching. You go in, you have it done, you're finished. And then you can use the trays to touch up every 3 to 4 months just to keep, your nice white smile.
So you can get a person from a darker color to those white colors
Absolutely.
that you showed us in the in-office?
Right, and the in-office is very effective. Now, not everyone is going to be able to achieve, some of the lighter shades. It depends on where you start. Older people tend to have darker teeth, so their result's not going to be as good as someone who's maybe in their 20s. Or if it is, it's going to take them much longer. So, and all of the systems, really, compliance is a big issue. So the reason that people like the in-office is because it's you go in, you have it done, and it's done. You don't have to wear it night after night after night and be very compliant. You just, we're a society that just likes to, have it done and be over, so they work very well that way.
Is it possible to over-bleach your teeth?
You can over-bleach in the sense that they can become more translucent looking, so they may have a blue tint to them. As far as damaging the teeth, there have been no studies to show that it actually damages the tooth structure itself. But I think from a cosmetic standpoint, you can over-bleach.
Now, if I go to the kiosk, at the mall, and they say tooth bleaching, what am I getting there? Is that as good as going to the dentist's office?
Well,
or is
actually, it's that's an interesting question because you're seeing the kiosks pop up in malls, cruise ships, all over the place. Really, what you're getting, because the products aren't purchased from a dentist, what you're getting is essentially most of the over-the-counter strength products. So something you can really do yourself is the strength that you're getting from the kiosk. So you're not getting the same strength that you would get from the dentist, nor are you getting a custom fit tray that fits just your mouth. So it's more just what you would be able to achieve yourself from over-the-counter products.
All right. Very good. Any other questions?
Thank you very much.
Thank you.
Thank you.